for the country. Now, according to the latest maternity audits, almost 16% of mothers who die before or shortly after birth die from blood loss. A third of these women die during or after caesarean deliveries. And in 70% of these cases, deaths during C-sections could have been prevented. You can see some of the numbers up there. 2008, 2014, 30% increase in the number of deaths there. 63% of these women died after caesarean section, of which 71% could have been avoided. Now, in most cases and instances, the lack of skills among doctors and a shortage of resources, especially in the rural hospitals, are to be blamed. Now, from our SABC Polokwane studios in Limpopo, we are joined by the Health Minister, Dr. Aaron Motsoaledi. Doctor, very good morning to you, Mr. Minister. First and foremostly, off the bat, you just heard some of the shocking figures there in terms of caesarean deaths. Should we be concerned about that, Minister?
Yes, good morning, and good morning to the viewers out there. Of course, we are very much concerned and we are monitoring it. Remember, the committee that is reporting this, the Confidential Committee of Inquiry into Maternal Mortality, was set up by myself as the Minister of Health because we need to know what's happening in order to stop it. And we are aware that there are 5 major causes of death for women who in pregnancy and childbirth in South Africa. And we call them the 5 H's. The first H is HIV and AIDS. The second one is hemorrhage. That means bleeding. The third one is hypertension. The fourth one is the health worker. And the fifth one is the health system. Now, what you are describing here, we ascribe it to the fourth H, is the health worker. One has noticed that for quite some time. I've spoken to the deans of our universities because I'm worried. The level of skills of newly qualified doctors is much lower than what I used to know during our time. I've checked some of those records about caesarean section death. I can assure you, I'm not trying to praise myself. I've worked in many rural hospitals in the middle 80s when I started practicing. Sometimes working alone in a hospital, I've never had a single maternal death from a Caesar, even performing that Caesar alone. The bottom line today is that the skills of newly qualified doctors have been found to be wanting. And we know some of the reasons. Many of them do not have trainers because most of their seniors, the lecturers, even at the level of professors, spend very little time in medical schools because they are rushing to their part-time practices in private hospitals. That's the reality. In something called RWAPs or remunerated work outside the public service. So the present medical students are not like me because I was lucky. I had all the lecturers and trainers at my disposal. They are struggling to get lecturers and trainers because they are fighting for those with private practices, unfortunately.
So how do we then address the shortages of resources in the public healthcare sector or the system, so to speak, Minister?
What resources?
The sources, the lack of resources.
What shortage of resources?
The lack of resources and skills that we need in the public sector.
Well, the main issue here is definitely skill. The resource that is needed here to stop hemorrhage is blood. We have arranged with the South African Blood Transfusion Service that they must have specific fridges belonging to South African Blood Transfusion Service in each and every hospital, especially those that are doing Caesars, and make sure that that fridge is always stocked. That means it's a fridge specific for obstetric emergencies and is put in that hospital, is stocked and run by South African Blood Transfusion Service rather than by the hospital itself. The other issue on skills, I'm discussing with the Deans and Health Professions Council so that a doctor must not be allowed to be released from internship unless they've successfully completed a certain number of Caesars, successfully and safely. In other words, to say when you are doing internship, you must do so many Caesars during that period which are successful and safe, is then that will release you from internship. Otherwise, we shouldn't. It's one of the new things that we are discussing. The other is that we have got a program called SMOE, which I had the professor speaking about. We introduce it to deal with this question of skills. SMOE means essential steps in the management of obstetric emergencies. More than 2,000 doctors have already been trained in the country, and about 4,000 nurses in SMOE, essential steps in the management of obstetric emergencies. The other thing we have done, seeing that there's a shortage of skills, especially in rural areas, we've introduced the concept of district specialist teams, where in each of the districts of South Africa we put in 7 people who are specialists, one of them being a principal gynecologist, the other a principal pediatrician, the other a principal midwife, etc. Now I'm quoting those because these 3 because they are directly related to the topic at hand now. So the specialist must be able in that district to identify skill shortages. In other words, a specialist in a district must be able to say there are 5 or 6 hospitals in district, there are 20 clinics or 40 clinics in this district that are doing where labor, women in labor can be admitted, and check the level of skills. And what is the level of skills by the midwives and doctors? Yeah. Once they identify the skills gap, that district specialist must put up a program for training. Yeah. In other words, they must say, we are going to bring so many doctors because they are unskilled in doing scissors. We are going to train them until they are skilled. So those are some of the things that we are putting in place.
Now, Minister, the increase of caesarean section, especially in the private sector, we heard now it's not in the public sector, it's more in the private sector. Why do you think that is the case? Is this more profit over the health concerns of the public?
We think it's more profit, definitely. Well, there's an argument that is about health concern, but according to my analysis, it's more profit. We have got a situation in the private sector where the caesarean section rate is now 70%, meaning all of a sudden 70% of the women of the country can no longer deliver babies normally. I mean, that's quite out of this world, because people have been delivering babies normally all the time, normally and safely. And the fact that the rate has gone so high, I think profit is the biggest motive. We also know that there's an element of litigation where they are avoiding litigation. But it's profit. We hear stories in instances where they are saying the doctor had to do a Caesar because he wanted to go somewhere. He wanted to be released. He didn't want to be observing the woman in labor for 12 hours. He has got other commitments somewhere. So the best thing is to do a Caesar and finish with that woman and go away. We do hear such stories, and that's why I want to believe that is more of a profit motive than anything else.
Is there a measure to deal with this particular tendency, Doctor?
Unfortunately, at the present moment, no. Under the present system, no. Mm-hmm. We are hoping when we introduce NHI, the National Health Insurance System, because we are going to be looking at the issues of pricing and cost very closely. Mm-hmm. We are hoping then we might be having an opportunity to look into this particular situation. Minister, as it is at the present moment, we don't really have anything whatsoever on the table to try and reverse that trend.
Yes. Just very briefly, today is International Nurses Day. Your message to all the nurses out there?
Well, I am going to address nurses in Polokwane in a few minutes' time as part of this International Nurses Day. Well, I'm going to remind them of the fact that nursing is a calling. I'm going to remind them again about Florence Nightingale, because sometimes we do find nurses who don't do their work, and they give the employer what the employer has done to them as the reason why they are not doing very well. And I want to tell them that their contract with the patients, being Florence Nightingale's, is not related to what another person is doing. It's a special contract with patients,
yes, and
which they need to respect, because I'm also going to tell them that they must realize nursing is a backbone of the whole healthcare system.
Minister, thank you so much for your time and joining us in our Limpopo State studios there. That was the